everyone doing? My name's Alicia. I'm representing La Clinica del Pueblo, and I'm very honored that you've chosen La Clinica to be part of this panel, and need to say how honored I am that the Inter-American Development Bank has been so supportive of La Clinica in general, and in particular this cause, because it's something that affects us all, and it's been very gratifying to see the involvement of bank staff in what we're doing. I wanted to give just a couple quick statistics about HIV in the District of Columbia. For those of you who are not aware, the District of Columbia is the highest HIV infection rate in the country and in the region. Its AIDS diagnosis rate is also the highest. In the most recent statistics, it's about 2.7 to 3% of the city has been diagnosed with HIV. There's an estimated additional 3% that is infected but does not know their status. This is a rate, in terms of qualifying for epidemics, anything over 1% is a widespread, significant epidemic. The district has been confronting HIV for a very long time. La Clinica serves a primarily Latino population. And for Latinos in Washington, D.C., the rate is better than the city's average, but not good. It's at just about 2.2% or so. I have the numbers here, but it's a little over 2%. And most alarmingly, the rate of what's called late diagnosis among Latinos is the highest. So people who are diagnosed with HIV and within the same year are also diagnosed with AIDS, meaning that they've been carriers of HIV for many years, potentially even a decade, and not know it, and then are usually diagnosed on the verge of being very sick. It's an extreme number, and it's very concerning. The other things that we're seeing is that the rates of infection, while it's been mentioned, it is not an epidemic that impacts just one community. Unfortunately, what we are seeing is that the highest rates of prevalence and new diagnoses are in young men who have sex with men, young minority men, African American men, and Latino men. And this is a population that is consistently marginalized and consistently falling through holes in the safety net. So what La Clinica does, in service in fighting the HIV epidemic, we have extensive services from education and outreach through counseling and testing, through care for folks who are diagnosed. We do a lot of specific targeted outreach programs for those highest prevalence communities, like young men who have sex with men and young transgender women aged 18 to 28. We have a really exciting center that focuses exclusively on that community. We do a lot of outreach in other targeted communities with targeted campaigns that really speak the language, figuratively, of each of those communities. And over 2,000, close to 2,500 HIV tests a year as funding permits. We do more tests. And then navigation into care, which, and I'm sure that Dr. Ruiz can attest, one of the biggest challenges once someone is diagnosed is getting them successfully into care quickly and then keeping them in care so that they can maintain these complex drug regimens. Even if they're not complex anymore, it's still a lot to manage for someone who's dealing with a diagnosis. So we provide a lot of supportive services and what we call patient navigation services to get people into care in we're averaging fewer than 8 days from diagnosis to navigation into care, and then making sure that people have the supports they need to manage what is now essentially considered a chronic condition that can be managed, but providing all of the supports needed. And as you alluded, this is not just a medical issue. This is not just an issue where providing the right medicine solves the problem. We have to be very, very heavily engaged in what they call the social determinants of health, making sure that people have access to a safe place to live, people have access to adequate food, people have access to the emotional support and the community support that's required. So La Clinica tries to do a lot of that and then engage with our partners to make sure that our patients and our clients get all the support that they need.
Go ahead. Hi everybody. Hello.